All right, so this week's topic is health and nutrition in Latin America. The homework question, one of the homework questions this week asks, what's the most important indicator of human health? The answer to that would be life expectancy. It turns out when you live in a country that is poorer or less developed, it's not only your quality of life that can be affected, it's also the quantity of life, how long people tend to live there. And of course, other important indicators of human health, access to clean water, sanitation, nutrition, and the child mortality rate. For lack of access to clean water, Clawson tells us that 5% still lack access to potable water. But this can be a little deceiving because access is only defined as having access to being within 200 meters of a public faucet that has potable water. And so, it doesn't mean that people necessarily have indoor plumbing, or that if they have indoor plumbing, that water is safe to drink. Contaminated water leads to issues, one of the most important of which is diarrhea. And childhood dehydration from diarrhea accounts for between 1/6 and 1/3 of early childhood deaths. ORT, oral rehydration therapy, is a solution made of sugar, salt, and water that is cheap and effective, something that they came up with, I believe, in the United States in the 1950s. And so that is an important contribution from the United States to the third world so that people don't die from dehydration from diarrhea. One of the critiques of oral rehydration therapy is that because it's cheap and effective, it inadvertently creates an incentive not to fix the problem, because the number of children dying and so forth goes down. So yeah, hopefully there's been more done on prevention so that they don't need ORT to rehydrate. Here's a couple different ways of measuring nutrition. One of them is undernourishment, the condition of not having enough food to eat. This can be measured by daily caloric intake or protein consumption. That's one. Yeah. The other condition that can come from relating to nutrition or not a healthy nutrition is malnourishment. It's where you are consuming enough food, but you're lacking a balanced diet. And so there could be a deficiency in essential vitamins, minerals, or protein. And the consequences of undernourishment and malnourishment is that there's hundreds of thousands of children that die from both of these each year. The child mortality rate in Latin America, the numbers that Clawson gives us are from 2015. And we learned that Cuba has the smallest child mortality rate of 6 per 1,000. And Haiti has the highest rate at 152 per 1,000. And so the smaller the rate, the better. And so just also interesting to see that both the best, Cuba having the best or the lowest child mortality rate, and Haiti having the highest or the worst child mortality rate. They're both in the Caribbean. This chapter also introduces us to automedicación, to self-treatment. And Clawson tells us that between 25 and 90% of initial treatments that people get are self-treated. And so this is, interestingly enough, one of those areas where the United States is actually becoming more, I think, or the first world is becoming more like the third world in that sense, where, because we have access to information, it is, people can now look up, their symptoms and decide whether they can take over the counter stuff, home remedies, or go to the doctor. And so in that sense, I think self-treatment in the US has been growing. But how do we see self-treatment historically in Latin America? One of those is pharmacies. We don't associate pharmacies with self-treatment, but the reason we might see it a little bit like that is that there's places in Latin America, especially in smaller towns, where people can walk into a pharmacy and tell the pharmacist, I'm having a stomach ache or headache or whatever your symptoms are. I've had them for X number of days. These are my symptoms. And then the pharmacist will be the one who tells you, okay, try this medicine, take 2 of these a day, and check in with me in a couple days if you don't feel better. In other words, it becomes a way of circumventing doctors, clinics, hospitals, prescriptions. It's a way of kind of it's a way of making healthcare more affordable for people who can't afford healthcare and going to the doctor and all that. Not to mention they might not have any of those things in their towns. And so then they could just go to a pharmacy and go straight to the medicine, almost like eliminating the middlemen. And so that's, there's so in a way, pharmacies, kind of become a form of self-treatment. I've also seen it a few years ago. I saw it in Mexico City, where there they require a prescription. But so when was it? 2017, summer 2017. I went to Mexico City with my parents. My parents wanted some medicine while we were there, and they went to a pharmacy, and the pharmacy said, sorry, we can't give you that medicine. You need a prescription. They're like, oh man, that's too bad. But then they said, oh, but don't go anywhere. Right next door, we have a little clinic with a doctor there who might be able to give you the prescription. And so you go just next door and you tell the doctor your symptoms and what you want the medicine for, and they'll write the prescription. And for like a super cheap price, and then you go right next door back to the pharmacy. Yes.
Like I know, like
yes.
I don't know. Like some things in the prescription here, you can just buy the
Yeah. So yes, it is common for people to go into Mexico and Canada, or to even fly to Latin American countries like Cuba or Colombia. And it's called medical tourism, where part of it is just cheaper pharmaceutical prices or easier access to medicine. But then the other part is also for the medical tourism, you know, like let's say here, I don't know, someone wants to get a surgery that costs, I don't know, $50,000. And they will go to a place like Colombia, which is really well known for having some of the best plastic surgeons in the world. And people will go over there and they'll spend $25,000 and they'll have like a whole vacation associated with it. Like you'll fly there, you'll stay in a nice resort. You know, you don't have to, you can stay in the resort. You don't have to go anywhere until you heal from your surgery, and all for half the price of what you would pay in the US. And so, yes, it's not uncommon for people to to go outside the US for medicines or healthcare.
And it's like the same with like dental procedures as well.
That's right. Because a lot of, even people who have health insurance in the United States, a lot of times it does not include anything beyond cleanings when it comes to dental work. And so it's very common for people to go outside the US to get their dental work done. Yes, good point. Botanicas would be the next way in which people self-treat. You might recognize botanicas from our discussion on religion, where botanicas is a place where it's a place that people go to buy kind of like home remedies or folk remedies to take care of themselves. And similar, like I mentioned before, people will show up there and say, hey, these are my symptoms. You know, do you have something natural for me to heal myself? And then it'll typically be herbs and rubs, but it also blends into like spirituality and religious beliefs, because sometimes it'll include things and pray to the saint, or and burn this incense, or and you could see our curandera in the back and she'll do a procedure to clean you of the evil eye or whatever. And so it can border into, it can vary from home remedies, natural remedies, to spirituality and other religions too. Midwives. Midwives are the people that have delivered babies for most of human history. But throughout the 20th century, Latin America was, you know, encouraged and pressured to, you know, move toward the first world way of having babies delivered by doctors. But now in the first world and in the United States, the last couple decades, we've been moving more towards midwives, where now when you have a baby here in the United States, you know, you get asked, like, do you want a doctor or do you prefer a midwife? And so there's more movement and acceptance of allowing people to have midwives. Now, midwives in Latin America can have a lot less medical training. You know, they may have just a lot of experience, where there may be a handful of midwives in a town, and they pass on their knowledge onto like their children or their grandchildren, and they just learn from experience, where a midwife will show up with an assistant, and that assistant will learn how to deliver babies. They'll both, you know, from the midwife, and then eventually become a midwife herself. In Spanish, they're called parteras. Then there's bone setters, which are, I put chiropractors in quotes here, because these are people that have experience basically like popping people's bones back into place. When you have an injury that has to do with bones, they kind of put things back in their place. There's also a history of there being bone setters in the United States, especially in Latino communities. Growing up in Los Angeles, I had experiences with bone setters where, let's say I would twist my ankle or something like that, and then my mom would take me to a bone setter. Typically, these bone setters practice from out of their house, or they'll come to your house. And I hated them. I felt like if they didn't make you cry, they didn't feel like they were doing their job. And so it's like, I hurt my wrist and they're like, okay, where does it hurt? And they would just push there and pull there and, swing your whole arm around. And like I said, I felt like their goal was to make me cry. And so I was not a fan of bone setters. So pretty much as soon as I became a teenager, was old enough to say no, I started saying, yeah, you're not taking me back to one of those bone setters. Like, no, thank you. Then there's curanderos or healers. And this also connects to the botanica. These would be, again, the people that might work out of a botanica or own a botanica. And they heal people with natural medicines. They tend to have a background, or sort of these traditions they can come from Native American healing beliefs, they can come from African healing beliefs, or even folk European healing beliefs. So depending on what part of Latin America and how much influence they have from those different three roots will depend, what they draw from most. The environment can affect what kind of health issues come up. The tropical lowlands historically has had the greatest issues with health. And that's because of all the insects that easily live there. And so there's diseases that come from mosquitoes, like malaria, yellow fever, that's also known as black vomit or dengue. There's diseases that are transmitted by flies and other insects, like Chagas disease and river blindness. There's the diseases that are transmitted by worms, and a variety of worms that can transmit diseases, from hookworms, guinea worms, roundworms, tapeworms, and sucker worms. So a lot of insects can play a factor in the spread of disease in the tropical lowlands. And that's why, say when there was the Spanish-American War, or in other wars when Europe, kind of northern hemisphere countries go into tropical lowland countries to colonize or do a war or whatever. Those countries historically lost more people to the diseases than they did to the fighting at the war. Then there's interesting things that affect people in the highlands, say, for example, up in the Andes. So there we're more likely to find respiratory issues. Hypoxia is also known as soroche or mountain sickness, which has to do with not having enough oxygen. But this can affect people that are not natives of that area more, because it turns out people that have lived in the highlands for generations, their bodies adapt to living in the highlands. They end up having increased pulmonary and cardiovascular capacity. They end up having larger than average chests, lungs, and hearts. And they have a greater than average bone marrow and red blood cell production, and an elevated basal metabolism. So it's just kind of amazing that people who live in the highlands for generations, their bodies adapt to live in those areas. Let's see, there's also a difference with regard to urban centers versus rural areas. In urban centers, there tends to be more respiratory issues because of the air pollution and smog and so forth. In rural areas, they tend to have issues related to lack of resources. So they'll have malnutrition, lack of access to water, to sufficient, the infrastructure for sanitation, and literally access to doctors, clinics, hospitals is more likely to be lacking as well.